Okay, welcome to those who have joined us this morning. Thanks for taking the time, and also to those watching the recording back. It is a very busy morning given the news that was released last night about everywhere eventually going into lockdown. So we appreciate that you're probably watching this back. I'm so grateful to have two incredible women who are advocating in the mental, emotional well-being and health space in Leanne Faulkner and Erin Oldman. So welcome, ladies. Give us a wave. So the way we'll start this, they are both unmuted, so we'll have a bit of a chat about what can actually be done at this time, what some strategies, places to get help from. Both of them they were just saying they have so many mutual connections in this space, so that's going to be beautiful because they'll bounce off each other beautifully. So welcome, ladies. Thank you so much for being here.
Thank you.
Thank you. Good morning, Kate.
Beautiful. So people might trickle on, so we'll just welcome them, and if they put their video on, that'll be good. If not, no worries. So ladies, I'll start with one then the other and just get a bit of an intro, and then we'll get stuck into some questions. So Leanne, I'll ask you first to introduce yourself and a little bit of your background and what brings you here.
Sure, thank you. Thanks, Kate. Well, look, I'm a small business mental health advocate, which means that I really do try to champion the resources and support that's needed for small business people. And I never expected that I would work in this space. And in fact, I'm doing my PhD in this space right now, and I lecture in this space. And I never imagined that I would, but I was a small business, and I still am a small business owner, had quite a growing business that I grew myself from my kitchen to about 2,000 retailers around the country and then internationally. And then the GFC struck, so I'm kind of reliving what's going on at the moment. I can so relate. And my business slowed down, and I in turn ended up not being able to cope with the realities of that, and I was diagnosed with situational depression. I had I guess in essence, I look back on it and say to my husband, I think I had a breakdown. And my husband says, I think you had a breakthrough. But anyway, and was quite shocked that there wasn't enough out there for small business owners. There's quite a lot out there in the mental health space for employees and for the general public, but if you own the business, and in particular if you're a micro business owner or a sole operator. So that kind of put me on this journey of advocating for more resources in this space, and I've been standing at the crossroad of mental health services and small business ownership, and I work at that intersection, and I've been doing that for about 8 years now. So and you know, I'm so happy to be here today, and I thank you, Kate, that we're having this conversation because it is a critical part of this experience.
Beautiful. Thank you so much, Leanne. And I've probably become a little bit of a fangirl of Leanne over the years. I first came across her when I went to a Business Excellence Forum and heard her story, and was very attracted to her warmth and generosity at that time. And then in more recent times, she came and ran a session for us as business coaches at Action Coach over in Adelaide. And again, I was just excited to reconnect. And then when I've had a few people reach out in the last week saying, please, Kate, what can we do? And straight away I'd messaged Leanne and said, I need your help, please. And then she said, of course, what can we do? And literally within moments of that being organised, the beautiful Erin, who I'll introduce now, tapped me on the shoulder and said, hey, you put a post up about looking after tradies. Let's talk. So really grateful. So thank you, Leanne. And Erin, we'll get you to talk a little bit about Mates in Construction now. So introduce yourself and what that's all about.
Thank you. Thanks, Kate. My name's Erin. So I, like Kate, didn't expect to be working in the space I'm working in, though, and I feel incredibly grateful and blessed to get to talk to the people I get to talk to on a daily basis in the industry. I am a field officer for Mates in Construction. So we have a number of field officers nationwide. We've been operating for 10, 11, 12 years. Right back 2007, 2008, we teamed up with the Australian Institute for Suicide Research and Prevention and started doing some research and collecting some data around the mental health and suicide rates in the industry. So my background is in safety and construction, so quite large commercial projects, large scale stuff, so building shopping centres and things like that. But it's a space in which you get to interact with every size business. So as you mentioned, Leanne, sole traders, two people sort of jumping in the ute and bringing the tools along. And there's a lot of, challenges that come with that. So I, as I say, feel very lucky to get the opportunity to talk to people across all levels of the industry. And that has continued with, so coming from a safety background, shifted over into the mental health. And we really work on suicide prevention in construction. It's, I guess it's the slippery slope or the spiky end of when overwhelm starts to creep in and people are not coping as well as they should or could with what's going on for them. So we talk to guys about how they pick up and notice when their mates are struggling. We work in the help offering space. It's really important to us that people, because we can pick up when someone's going sideways around us, things are not going well for them. We're very good at masking what's going on for us, a lot of us, where the masks are very solid. But having said that, when things start to get really, really serious for people, we do tend to pick up those signs and invitations that there's something going wrong in their world. So we encourage people to first notice those invitations or those signs, and I'll explain more about why I use the word invitations. It's about picking that up and having a conversation, offering some support, because a lot of us struggle to pick up the phone and reach out to help and do that help seeking stuff, which we're doing really well. These days we're doing much better in the media and in the conversations we're having about where to go, where the resources are, and putting phone numbers out there and available for people. But our approach is that phone numbers don't save lives, people saves lives. Sorry, stumble on my words there. So yeah, as I said, I didn't expect to be in the space. I've got family, family tradies, and look, wherever we live and work and whatever we walk on and where we send our children to school, it was built by a tradie. So my experience with the industry is that they're really warm-hearted people who know how to make the best of things and give everything a go. And I enjoy that space and I enjoy their approach and their attitude. So I get a lot of personal, gratitude out of working with them as well.
Beautiful. Thanks so much, Erin. Thanks, Leanne. So, I've got a healthcare background too. And so that, as far as all of this sort of meshes together, I find that background has been really helpful to me in being able to support or diagnose what I can see happening in front of me in the mental health space, whether it be with clients or friends who have got trades background. And I think, having services out there and people like you too, Leanne and Erin, that people can access and get support from, or to be directed in the right way, is really, really helpful, because we as coaches, or we as wives, or as the tradies ourselves, when we see it, like you said, Erin, it's about, we can see it quite often, but we're a little bit scared and unsure of how to navigate that. And I think that's probably the biggest challenge. Now, I'm not backwards in coming forward, so I'll just name it for what it is. I'll say, you look like shit, you sound like shit, you're behaving like shit, what's going on? But not everybody has that, I guess, confidence to do that, because it is such a touchy subject. It's getting better. I think we're much better, like you said, but really important that we do this. So for the ladies in the chat, on the webinar, just pop in the chat. You are open to ask questions. We want to make this interactive. I can't see people because a lot of people got their video off. If you want to put that on, if you're not too shy, we understand if you don't want to. But perhaps just pop in the chat where you're from, and if there's a specific targeted question that you want answered by Leanne or Erin or myself, please just put where you're from in the chat, so we've got a bit of context. and also if you've got a question. And we'll just carry on, but I'll read out those as we go. So we might start with you, Leanne, and then obviously we'll interact between the three of us. So chime in, Erin, at any time. So what do you see are the biggest challenges? I mean, given the climate we're in right now, obviously, if we can speak to that as much as possible, but I think the general principles remain the same whether we're in crisis or not. Would you agree? Or
Yes.
Yep.
Yes.
Cool. Yep. So what are some of the biggest challenges for business owners in this space at the moment, do you think, Leanne?
I think firstly it's knowing what help is out there and what is available. And I think that we can be quite a pragmatic and very practical bunch. And so what we want, it's interesting because quite often my discussions around working well and mental health at work is very much tied into my business skills and my resources. Because if there's an application that I can apply in my workplace that makes a difference, it'll probably have an impact on my well-being. So I think the first thing is we need to know where can we go to get information about what's out there to help me or to help the business or to help my partner.
Mm.
This morning I went to treasury.gov.au, and there is a fantastic handout that I've printed out, but a PDF that actually outlines all of the packages, all of the help that is available right now. So, and to give you an example, and I notice you've got it up on your board there, Kate, I can just see planning behind you. Yesterday afternoon, my husband and I sat and watched the address from the Prime Minister, and we listened very carefully, of course, to what was happening for small business and sole traders. And we took note of that, and then we sat down and actually made a plan and said, okay, given all of the resources that we now know are available to us, what are the likely, what might be the scenarios that we're facing in our household, and what plan, given we've now heard about all of these resources, what plan might we put in place? That was not an easy conversation to have. That's actually quite a scary conversation to have, because nobody likes to talk about what happens if the money isn't coming in.
Yeah.
But I would suggest that that's probably the first step today at the moment, is to find out what's available. Don't ignore your situation. Yeah. I've been there. I know what that's like. So don't be afraid to have some conversations. I'm very grateful for the fact that I do quite a lot of work with COSBOA, which is the Council of Small Business Organisations of Australia. I do quite a bit of work with Kate Carnell and her team at the Australian Small Business Family Enterprise Office. I've done quite a lot of work with the ATO, and I've had in my past some very hard conversations with banks. So I'm very grateful for all of those opportunities now and that work, because I can tell you that there's a lot of people out there advocating for the support of small business and to support micro and sole operators, which I imagine is quite a big part of your space that you're working in. So my first suggestion is take stock of what's available and start to put a bit of a plan in place, because you'd be amazed at how that pragmatic step, that very practical step, can have such a big influence on our mental health and well-being.
Oh, absolutely. And so, Leanne, if you don't mind, if we reflect back to GFC times, because can you, and because I would suggest that those feelings you said before, I'm back a little bit, I'm reflecting on that time.
I am.
What challenge, I guess, did you face that people will be faced with now, and what are some of the couple of things? Obviously you got through it, so what were some of the key things there that you felt this way, and then this was what you did? So just touch on that.
Yeah, absolutely. I guess I felt initially through the GFC, I felt very, very scared, and I felt unsure. I felt that I had the weight of the world on my shoulders because I had employees. and I had small business suppliers, and I had customers. And so I took it also very personally that if I was unable to survive, that I was a failure. I also felt quite isolated at that time. Like I was the only person who was getting it wrong, and everyone else seemed to be doing it well. And there must be something going on that I don't know about. And in fact, the reality of it is that the experience was very much a shared experience. And that's why we need to have so many more of these conversations. And I'm sure that Erin will talk a lot about connecting and peer support and connecting with one another. And that's so critical in this time. And I guess I felt hopeless and overwhelmed. And now what we have in place is a whole range of very proactive supports for micro business and sole operators. And I had some very, very dark thoughts at that time through the GFC. And I am absolute. I was only thinking about this yesterday. I'm actually walking, living proof that these circumstances, as scary and hard as they are actually survivable. So together, helping one another, we can get through. And I had to have honest conversations. So I had to get brave. I had to put my brave pants on, and I had to actually say to my partner, I'm actually not coping at the moment. I'm struggling with this. What I didn't do well was have conversations with my team about that. And now, things are different now. And if I could turn back time, I'd have a lot of conversations about that. Because I think, we're all adults. We come to work, we care, we connect, we support one another. And I think those conversations are so important to keep it real. It is real.
Yeah.
This notion of an entrepreneur having all the answers, being a high flyer, being resourceful, having all the money in the world, and being the, creative, invincible one is actually the exception and not the norm. There's only one Richard Branson in this world. But here in Australia, we have over 2 million small businesses.
Yeah.
So let's get real. It's actually, we're all in this together. And if you're feeling some stress and emotion and struggle at this point in time, I can guarantee you are not alone. Your feelings are going to be shared within your community.
Absolutely. And I think you've hit the nail on the head there, Leanne. I think we all feel that we have to have all the answers as business owners.
Yeah.
And our tradies especially are like, I need to have this under control. And I guess what I've been encouraging a lot of the people I work with to do is to be vulnerable right now.
Yeah.
Let them know that shit is sort of hitting the fan either internally or from a business perspective, and we're not really sure. It's uncertain times, and I guess even people in our positions where we're trying to lead through this, both Erin, Leanne, and all of you, like it's a vulnerable place to live. Every time I get on a live at the moment, I'm going, guys, I don't have the answers, but shit, I'm giving it my best, And so being vulnerable like that, and even if you have to lead the way as the tradie wife, and doing that with the staff, then they will come along. But sometimes it's about how you hold that hand. So I'm just going to touch on the chat just quickly before I come over to you, Erin. So we've got Ballarat. I know Stacey's in Bendigo. East Gippsland, a plumbing business. Another plumber in Toke, Marissa. Another civil plumbing, Cal in Geelong, and Stacey in his plumbing Central Vic. All's been well there. It was pretty relaxed until last night when she started to see a few signs from the tradie with the uncertainty around what is essential versus non-essential. We won't get into that in depth today, but you're a plumber, love, you'll be right. And she said that she'd mentioned this to her tradie, and he said, oh, don't worry about me. He's already a little bit in that denial space, quite possibly. So it's about, looking for those signs. So Erin, we might pop over to you on that. Thanks, Leanne. Beautiful. And thank you for sharing that experience, because all of those descriptive words that you've described is exactly how everybody's feeling. I think we'll all agree. So Erin, what are you seeing? What are you hearing? Give us a bit of a rundown on how we go about this. What challenges do you see, not only all the time, but especially now?
Yeah, thanks, Kate. And look, similar to what Leanne was saying, as you just picked up on, the description of feeling a bit scared, a bit sad, a bit angry, a bit lost. And to take it back to the GFC time, I actually went through a redundancy at that time myself, so it felt the same sorts of things. And look, that touches both what we see in a normal scenario, which we're certainly not in now. But it is really important to remember that those reactions are normal. So we're reacting normally in an abnormal situation. So I guess it's having patience with each other and having patience with ourselves, because we understand that, yeah, and we're going to go through that range of emotions basically on a daily basis, I guess, as we get more new information which we don't understand. I think uncertainty is the key word for a lot of us. It's changing so rapidly, and we know that sort of uncertainty, even talking to that last chat question about the tradie saying, what's non-essential and what's essential, these are big questions that we don't have the answers to. For me, when I was made redundant, and for what I see when I'm talking to guys, I think, and very much a personal experience of it, it's really important to just, I guess, take one day at a time. And at the moment, it's hourly. The news is really coming in so thick and fast, and unfortunately, with the digital age and the globalization of things, we're also dealing with lots of misinformation. What's real information? What should I be acting on? It's a really tough time for everybody. So I guess also to pick up another thread from what Leanne was saying, I think it's a really good idea to, I guess, demonstrate. You were just saying, Kate, about being brave. And I think there's finding a balance of a time to be brave and show that we're brave, and rely on skills that we previously have. We're talking about tradies. These guys are solutions guys, so that as a double-edged sword. They'll be looking for fix-its. They'll be looking for rapid solutions and wanting to move on to the next thing. But that's not really the space we're occupying at the moment. It's a bit of a wait and see in the very short term. Yeah. So it's finding that balance, I think, between being brave and making those plans, doing that planning, and certainly looking out for those resources. I reiterate what Leanne said earlier. There are compassionate people in government organisations, in industry-led organisations, in agencies, in referral, in health spaces all over Australia, where I find through the work that I've been doing, one thing that stood out to me is that often our strengths can become weaknesses and vice versa. So I think looking at the strengths that we have in our industry and that we have as individuals, as tradies wives and families, we've come through tough times before. This is a more interesting time than most of us are used to. It's unprecedented, which means that it's new for all of us. But we do have a lot of strengths that we can rely on. And I guess it's in talking to tradies, I mean, shout out to all the plumbers. One of my field officers is a plumber, and actually, Leanne, you may remember Jorgen spent a lot of time plumbing throughout his life.
Yes.
So look, I think it's finding a balance between allowing yourself to have the scared, confused, angry, uncertain feelings and bravely showing them, so demonstrating to other people that it's okay to have a mini meltdown or burnout or a breakdown or a breakthrough or whatever that looks like. And just, I guess it's one day at a time, 1 hour at a time. The more we can show people that it's okay to have that little meltdown and to give ourselves timeouts and all those different skills that we have that we've learnt, the more they're going to be able to do that. And just to pick up on that chat as well, we brushed it off saying not to worry about it. I think that's what we see in the industry with tradies in the construction industry. I've experienced it since day one. It is a standard go-to. No, don't worry about me. I'll be fine. Should be right. No, I'm fine. And they will maintain that endlessly until the crack gets too wide. And I think it's about, and you touched on it earlier, Kate, about how a lot of us are brave enough to step into that space and actually push a little bit and get a bit stroppy and say, no, I can see you're not okay. You look like shit. You're not sleeping. I can see all these things. You're not okay. but the next step of what to say next, what to do next, and I look forward to talking about that conversation or that part of or aspect of it quite soon, because I think we'll be touching on that.
Yeah, for sure. And I guess that's probably a good segue there, Erin. Thanks so much for that. So you started touching on some of the signs or the things that we can be looking at. You said, you're not sleeping. I said, you look like shit, that kind of thing. So just to hear from both of you, and we'll start with you, Erin, how do we, what are some of the things that we need to be looking out for? And, we know our partners pretty well. There's going to be some of the tradies watching this hopefully for themselves too. So both on the coin of I am the tradie and this is what I need to be looking out for, or I am the partner or the mother or the daughter or the whatever. Give us a few of the things that you sort of are educating people in to keep their eyes out for.
And I like the choice of phrase there, Kate, because it is about educating people. And I sit in a very confident position to talk to this because, back in the late 2000s, we did this research. We talked to 167,000 construction workers about what that looks like for us as tradies. So, very male dominated. So I think it crosses, we're now working with energy. We have mates in energy and mates in mining now as well. So, and we're seeing, the same conversations, the same things coming up. So I don't think it's unique to construction and to tradies, but certainly it's coming through very strongly. And look, it is that number one, I when I ask people or talk to tradies about what's going on, you see they're not sleeping a lot. Mm-hmm. So, and just, if we were able to have and I'll invite the ladies who are listening and participating, if you want to type into the chat message, some of the things that you think that you would see while I'm talking. But yeah, the data shows that we respond in the ways you would expect. You see a lot of anger. Anger's a go-to emotion for a lot of us. Culturally, it's acceptable to get angry with stuff, and it's men are particularly comfortable with that aspect of showing their feelings, I guess. So we see anger. We see people withdrawing. So they're going into that man cave, which is, I go in there sometimes too. So it's not just for the half the population. The rest of us too tend to withdraw as well when we're trying to process things. And if we're feeling bad, we don't want to spread that bad feeling around. We want to go and try and sort ourselves out in the privacy of our own cave. So I certainly see there's one there in the chat there saying about distraction. And certainly also trying to distract themselves, but also showing signs of distraction. So most of us running our own businesses, it's important that we're on point all the time. And when you're seeing a bit of carelessness creep through, where they're usually dotting all the I's and crossing the T's, and suddenly it's like, oh, I should be right, we'll worry about that later. They're trying to prioritise with pressures, and that can show up as carelessness around not getting things sorted or trying to distract themselves and not deal with it, basically. Certainly anger and frustration, definitely. Mm-hmm. And the not sleeping also sort of exacerbates that. So, they're lying in bed, just stuff whirring around in their heads, and they're trying to find solutions for things that they don't have solutions for. I guess drinking and drugging more than normal, sorry. Yeah, I was just looking over at the chat. They're not eating, having nightmares. Sleep interruptions is a really solid sign. And look, I called them invitations earlier, and we call them invitations for a reason. It's someone's changing their behaviour and inviting you to respond to it. Like you described earlier, Kate, you're picking up on what people are putting down. You can see. These are people we spend a lot of time with, our loved ones, people we work beside, friends and family. We know what their normal is, and it's effectively just not that. If you can say, look, you've changed your language, you don't normally say stuff like that. You're normally pretty glass half full. Suddenly you're glass half empty all the time. That negative stuff creeping in a lot, and attitude changes. And yeah, basically anything that's not their normal. Suddenly you're doing this, you're saying that. That's not like you. I'm worried about you. You don't normally say those things and do those things. So again, these are people we know pretty well. So it's about trusting that gut instinct or that judgment or that idea that we see, yeah, there's an opportunity to ask a question here about what's that about, because that's not like you.
And I love that language, the invitation, because I think, you know, so often it would be described as, you know, if we get a bit medical, a symptom or that kind of thing. I think if we shift the language and say that is an invitation for me to do something, it's an invitation for me to ask a better question or to, you know, show care and concern. I love that. I think that's brilliant. And, you know, these are things, and, you know, poor Sarah with her husband and the situation that he's in at the moment, that's a huge invitation that says, you know, we've really got to, I've got to have a conversation here. Now, so Leanne, how do you, just in conjunction with what Erin's sort of described there, what other sorts of things did you either personally experience or have you heard from people that you've worked with that the ladies can kind of keep an eye on, or if you've got some strategies like Erin says with the invitation?
I think Erin has really touched on some very common shared experiences, and I think that's great. I will probably add a couple in that I hear from both ends of the scale, which is from the small business owner but also from the agency at the other end, is this notion of ignoring things and thinking it'll just go away. So if I don't, if I haven't been able to pay my BAS and I just keep letting any calls go to voicemail, and then I don't ever respond to a call or I don't ever answer an email because it's too much for me to actually face and cope with, that's definitely an invitation, I would say. Being present at a family dinner table but not participating in the family meal. So the body is there, but for me, I went to a million family events like my kids' soccer and family birthdays and dinners and whatever, where my body was present but my mind was actually at work. So I might look like I'm at the table, but if I'm not engaging with the kids at dinner time, if I'm not having those conversations but I'm physically there, I would say that is another invitation. I think generally we when we're in a micro business or sole operators and we're being supported by family, we do see anything that's changing in behaviour, like drinking more than usual, eating more or not eating. I think somebody mentioned that actually, not eating. Josie mentioned that. I think that anything that is different to my normal usual behaviour, particularly at the moment, would be key to look out for.
And I think, you know, in this very digital age, and you talk about presence, and even yesterday I was at the family lunch table and I named it. I said, family, I'm not present right now because I can't stop thinking about all the ladies with tradies out there. So I'm just flagging, I'm here, but I'm not here. And it's not because, you know, so even being like acknowledging that and maybe naming that elephant in the room can be helpful too, because that alone caused my mother, which is very interesting. And this isn't about me, but it's about how this then spirals out. My mum would never say this, but she said to my tradie, I need you to keep an eye on my girl the next 2 weeks.
Yeah.
So just by me naming I'm not here, like I'm here, I'm with these people, and it's not that I don't love you, but I'm with them. If if you hear that from them, your loved ones, that's that invitation that Erin spoke about. And I think the avoidance behaviour, huge. Sorry, Leanne, you wanted to...
I think that's a really good point that you raised, Kate, and I think something else that I know works for me with my partner, with my husband. When I'm concerned about his well-being, I tend to start my conversations often by talking about behaviours that I've noticed that are different. Whereas if I said to him, oh, you seem really grumpy, or you just don't seem yourself, he immediately gets defensive. But if I say to him something that I've observed, an actual behaviour that has happened, and that's kind of how we begin the conversation, his defences aren't up
as high
initially. He will often go, oh, Yeah, actually, I didn't realise that I had done that, or, you know, it starts the conversation.
Thanks,
Can
Erin.
I chime in there, Kate?
Yeah, sure.
Absolutely. And that's, you talked about how do we educate people, how do we, you know, have this discussion with tradies and in the industry, and exactly that. It's about, I've seen this, I've noticed this, I'm worried about that. So you're sort of feeding back to them what they're inviting you to respond to. It's very hard to, I mean, I'm not guaranteeing this is a panacea for defensiveness, because, you know, we're still going to be dealing with that to an extent. But a good way I think to approach it is exactly what you've just described. Is look, I'm just seeing this, I'm hearing this. It's hard to deny with or to argue with those as sort of facts, if you like. It's like, I'm just telling you what I'm seeing, and it's worrying me. I don't like seeing you like that. If you're suffering, you know, if this is, I've noticed, yeah, I've noticed, I'm seeing what's going on, I'd like to help if I can.
Yeah. So those are just some things to start your conversations with. And I think some of the girls who have worked with me a bit before, who are on the call, and those who have listened to my stuff, we've got to pull out all judgment in the way that we're delivering our questioning. So it's very much about the observational side rather than that you're grumpy side, which is passing a judgment. So in the way that you position your questioning, it's got to come from a place of care, compassion, and understanding. So help me understand, babe. What's happening for you? You're waking up in sweat, or you're not eating very much. What's going on for you? And then be quiet, because we are fixers as women, and we want to jump in with the solution and fix them and nurture them and make it all okay. But that's not allowing them to continue with their invitation. So, yeah. So Leanne, have you got something to add there? Or?
Oh, I'm just, you know, I'm so glad you can see me shaking my head, because I completely agree with you, and I really do think that if I'm going to start to, you know, make those observations and have those conversations, I need to be able to continue in that conversation with unconditional positive regard, and I need to be able to build trust that that this, whoever I'm speaking to, might be my partner, can comfortably connect with me without me slipping into you know, judgment, I guess. So we really want to try and get the conversation happening first.
Yeah, and I think
in a safe way.
Yeah, and the challenge we're all faced with right now is that we are all nervous and scared too.
Yeah.
And so, you know, all of this applies for us ladies. We're talking about them, but it's actually about us too. So make sure you're looking in the mirror and doing this stuff as well. And when they respond to your invitation, don't flick them off either, because this is a two-way street. It's important that we're, if they've come to us and responding to our invitation, that we too respond in a way that goes, oh, thanks, babe, for noticing. I'm really grateful that you can see that.
And I think, Kate, it's really important, because we often, being reactive humans that we are, we might jump in and do the wrong thing initially. We might get initially defensive. We might brush them off, and the things that you're describing there. It's never too late to go, oops, that was defensive. I apologise. Come at me again. Sorry, I overreacted. I didn't mean to do that. That wasn't what I intended. Can we start that again, please? Because, you know, practicing this language makes it easier too, to be honest. And we're all defensive at really not good times, you know. And it's never too late, I guess. It's
I love that.
Great point.
We can undo that bit if we did it wrong. Whoops, I did that wrong. I need a do-over. Can I go again?
Yeah.
Ask me again.
Take two.
Yeah.
A little thing. Yeah. So that's brilliant. So, ladies, I just so tell us a little bit about, you know, well, a lot about, if you can, where to from here. So, you know, we've had the invitation. We've gone with care and concern. We haven't been judgmental. We're seeing the invitation screaming at us. Where to from there? So we'll start with you, Leanne.
I was going to say probably good to start with Erin first. Yeah,
perfect.
Particularly being industry specific.
That's right. Yeah, perfect. Yeah, perfect. So hit us up, Erin. Yeah, what do we do now?
Well, so, and it's interesting, you've just described the 4 exact steps that we use. It's about telling, I've noticed, I've seen, I've heard, and this is what you're feeding me. Here are the facts as I see them. Ask, what's going on for you? Listen without judgment. So we're asking, what's this about? And we do some training around suicide prevention, and that could be the question, is this about suicide? Are we talking about life and death here? We listen without judgment, because again, a lot of the stigma around mental health and the reason culturally we've ended up where we are around mental health is that fear of judgment. If they're not going to be made to feel worse or told to harden up and take a cup of concrete, or leave your home problems at home and, you know, leave your work problems at work sort of stuff, then people, it's encouraging people, them and us, to open up. So tell, ask, listen without judgment, and then connect. So again, the top 3, the first 3, most of us are caring and compassionate. We've noticed, we wade into that conversation. You look like shit, you're not sleeping, what's going on, as you described before, Kate. The harder part then is then what do I do next? How do I connect them up with some help? So as I mentioned earlier, in Australia, we are very strong in terms of resources, references. Leanne described all of this, the help that's out there, and it's multiplying and amplifying right now in terms of what we're setting up locally, regionally, statewide, nationwide, in terms of what's accessible. So I'm sure Kate and Leanne, together we can provide those resources. I feel like even though the Googling part and finding the financial resources part can be time consuming and difficult, it's there. So it's actually about, how do I connect you? So for example, you've got a plumber in your world and he's going, no, I'm fine, you're overreacting, it's all good, I'll be fine. And again, I go back to that, remember, this is normal. You should be feeling worried, uncertain, sad, angry. But if you're suffering and you're really struggling, then, you know, who do we connect you to? So we talk about, and Leanne, you might have heard, nothing about me without me in the social worker word. Well, yeah, so nothing about me without me just means don't make the decisions on my behalf based on assumptions that may be incorrect. We might think we know what's going on and what's best. As you said before, we're all fix-it machines. We want to dive into that fixing, and at that listen stage, we tend to dive in with the fixing. Again, if you do it, just undo it. Just go, oh, whoops, I went into fix-it mode there. I'm sorry, keep going. That sounds really tough. You know, and that's one of my go-to phrases. Geez, that sounds really tough.
Right.
And then just pause and let some space happen so that they can move into that space. And that pause might be way longer than we feel comfortable with. We know about awkward pauses. Yeah, we all want to jump in there, but it's about sitting with that awkwardness, because that could mean the difference between him opening up and telling you what's going on and not, if we start jumping in and trying to fix stuff. So the listening and then the connecting. Who do you want to talk to about this? Is it me? If it's not me, is it your best mate? You know, another tradie that gets it? Is it your boss? Is it your leading hand? Is it your apprentice? Is it your dad? Or is it something more serious and we need to go and get some professional help with this, because there's lots of stuff out there. And it can be, you know, the range of access to this sort of support is just phenomenal. It can be face-to-face. It can be a chat. For the under 25s, it's Headspace. It could be Headspace. There's lots of different ways that we can access this. And again, I can't reiterate it strongly enough. What do you need? Look, I'm not going to, if you don't know, if you say, look, I don't know, I don't know who to talk to about this. I don't know who's going to get it or who's going to be able to help me. Sure, I've got some ideas, and have that pre-prepared, have those resources available and go, look, you know, we can, and particularly we're good at that with tax and finances and you know, PAYE and all those bits and pieces. But in terms of if it's a telephone Skype or a counselling session, or if it's Lifeline, people always think Lifeline's crisis only, but
yeah,
you know, that they'll spend 20 minutes talking to you and just letting you, or listening to you rather, you know. So these, it's bringing down those barriers about how bad do I have to be to actually reach out for some, you know, to reach out to Lifeline or to get some counselling happening. You know, we all tend to think, I've heard so many people say it, particularly women say it, you know, I'm not that bad yet. Well, how bad do you need to get? You're suffering. You're not enjoying your world right now. Let's reach out for some support from somewhere, whatever that looks like. And of course, I'd be remiss if I didn't talk about Mates in Construction being available 24/7.
Please.
Yeah, look, and the same thing happens with our help and support line. A lot of people think it's just about suicide. We want to get to people before it gets to that, before, you know, when you've got 1 or 2 problems and you're not sleeping and you haven't slept, you've had insomnia for weeks, you know, we want to get to people and offer them some support, connect them up with whatever resources that they need before it gets to that.
And Erin, can I just ask you, your support line is available to anybody like in the construction industry, not necessarily just working for big businesses, but, you know, sole, tradies, subcontractors, anybody, right?
Absolutely. Thanks for asking, Leanne. It absolutely is. It's everyone in the construction industry and their loved ones. And we don't turn anyone away. If someone rang up and said, look, my husband was in the construction industry, you know, he's shifted into hospitality or something for the time being, we're not going to, I'm sorry, call us back when you're a tradie. It's whatever we can do to support people, mining and energy as well, so those sectors. And we actually have Mates in New Zealand kicked off at the end of last year. So in terms of the small businesses, regional, residential, fortunately, we got some funding earlier this year that allows us to move into that space very strongly. So we've created some new tools that work really well with that aspect of industry. So instead of stopping an entire construction site and having a training session together on site, we can do a back of the ute toolbox talk, you know, 10, 15 minutes, have a yarn, and very similar to what we've done here. What are the things we notice? Nate, let's talk about some of the things we see, some of those invitations. How do we ask about them and connect up, listen, and then connect up with help? So that's generally, we'll spend 10 minutes at the back of the ute having a chat about that. So open to everyone in the industry at all levels.
Fantastic. Fortunately,
we're very happy that we've been able to move into that space finally. We've had to pick some low-hanging fruit previously, but now we're 100% committed to that aspect of industry. And we also focus on apprentices as well. So if you've got any young apprentices, at some point, did you want to hear the stats around suicide? Kate, did you want me to go into that space?
Yeah, it's you know, I knew it wasn't good, but when you actually told me, I almost choked on my own saliva. So please share, because it's pretty alarming.
It is. So again, we're very evidence and data and research based. We're committed to evidence and being evidence based. And so the research, I mean, we have an issue with suicide globally. We have an issue with suicide in Australia. We certainly have an issue with suicide in our industry. So in Australia, we lose 8 people a day to suicide. So 6 of those are men. And in our industry, we're losing a construction worker every 2nd day in Australia. So very shocking stats. And when we talk to the guys on site, they're all shocked too. You know, this is not something that we hear on the nightly news. We'll hear about the road accidents and the deaths by accident, but we're not very good yet. We're starting to change. We are doing much better in the conversations we're having in this space and publicly how we're reporting on it and in the media and things, but it's very slow. It's a glacial change, unfortunately, but we are improving. But it's not something that you would hear of on a regular basis or know what those stats are. You know, it's leading cause of death in men under the age of 44 in Australia. So we're talking, yeah, and you guys, if you want any further information or data on this, our website's available, so matesinconstruction.org. And I've got actually a fact sheet that we've put together particularly for the virus reaction or response.
Right.
Things to look for, again, just reiterating what's normal and then how to connect up with the resources. Again, relying on our toughness. You know, we're resilient, we're tradies and we're Aussies, so we're good at looking after each other. It's just that extra step of how to do that, and particularly when we're at home. You know, a lot of us are sort of spending a lot more time together than we're used to. So in this new normal that we're going to experience, at least temporarily, if no one's sure how long for, but I'll make that fact sheet available on PDF so that Kate can share with her audience. And look, it's about, I think I covered off all those stats. Let me just think that I haven't missed anything. Leading cause of death under the age of 44, and in our young workers, really, really high stats. And what we're seeing in terms of what was a trigger event, relationship breakups can be a real trigger event for men particularly. None of us get out of it unscathed, of course, it's not, but broken hearts can heal unevenly. And so we see relationship breakups can be a big trigger. And I just wanted to, before I let you move on, Kate, sorry, Leanne, you mentioned something earlier that I wanted to pick up on. We often think that it's anger and frustration and drinking too much or more than is standard, but it can be the opposite as well. With suicide, it can be drinking less. It can be going quiet rather than getting angry and loud. It can also be getting really interested in planning and insurances and life insurance and making those sorts of plans. Giving away possessions is a bit of a reason to ask a question. It can be an invitation. It might not be about suicide, but if we get that gut feeling that there's something more going on, it's a good opportunity to ask about that. And yeah, and our young guys in particular, a relationship breakup can be a really hard thing for them to get through. So it's just about what's going on for you. What do you want to tell me? If it's not me, you know, if you don't want to open up and tell me your story, who can you open up and tell your story to?
Love that. And I think that's been a massive takeaway for me, Erin, in this call especially, is that who do you want to talk to? Because I think our immediate knee jerk now, Leanne's posted some great links, and we know that we've got mates in construction now. The temptation, girls, is going to be to start throwing that down their throat. That's not what we're hearing here. What we're hearing is, who is it that you would like to talk to? Now, for some of you who know me, it might be me as your coach. It might be an old boss. It might be the person they did their apprenticeship with. It might be an uncle, their father. But I love that. Like, that is just so good, and I'm going to take that everywhere with me. Thank you for that gift, Erin, because asking who, that is an absolute winner, because we want to push, but we need to allow them. That's coaching, girls. That's coaching them to their own solution, which they're going to be much more open to than if we push in to fix it.
Absolutely, Kate. And if they are part of the plans that we help devise, we're much more likely to stick to, you know. And we do at the moment, we've put a hold on all of our training for obvious reasons. Unfortunately, in the suicide prevention space, we can't do our training online, but when we are back up and running, I encourage everyone in all states to jump on our website and look for we do connector training, so it's free for the industry, and you ladies can do it and your partners can do it. Anyone can do it, anyone in the industry. So it's we do a general awareness, or the back of the ute toolbox talk, where we say, look, have you heard about the stats in this industry? Do you know what we're dealing with as an industry? And we build the capacity of the industry to respond to it by offering help, offering a connection, and also asking who's the right person for you. Has someone helped you out before? Was it, your brother was there for you last time? Do we need to call your brother? And I can't emphasize this strongly enough. Let's do it now. Let's grab your brother and get him on the phone. That's what we teach our guys to, or the messaging is really strong in that we struggle to pick up the phone, and it's not just men. We all struggle when we're in a bad place. It's hard enough to make a dentist appointment or ring up the bank. To reach out to a stranger or a resource that we've never met before, and generally it's actually a very practical barrier, because you'll get on the phone and just don't know what to say, or you get overwhelmed with emotion and can't speak. And I've seen that so many times, and we say to people, call Lifeline, call your doctor, maybe call your EAP. We all have, a lot of us have employee assistance programs, or we have loved ones that we can have access. So there's such a huge range of access, and our case managers, if you do call through to us, it's a 24/7 help and support line. It's I'll give you the phone number, Kate, you can check it in the notes there. It's 1300 642 111. 24/7 help and support nationwide. And we will hook you up. We'll give you some ideas of where you can go depending on what issue you're dealing with and what that looks like. So it is really important to get that professional support around mental health, particularly if it's about suicide. Back to that training. Sorry, Leanne, go ahead.
I think that's the great thing too about a smartphone, that you can put on speaker. And so you could be somewhere in a confidential room, but you could do it together. So you could say, I'm here, we've decided we're going to call together. My name is such and such. I'm sitting here with such and such. And that can make the conversation easier to have if it's with someone you may not know, or if you want to reach out but you're a bit unsure.
That's absolutely vital, and that's thanks for picking up the thread that I'm confusing myself trying to talk about 3 different subjects at once with the training and things, but absolutely pick up the phone and I'll do it for you. Because the reason we're called Mates in Construction is because anyone that we're talking to that might be struggling, act as a mate. What would a mate do? I would chuck you in the ute and drive you down to the GP. If you're in a really bad state, I would chuck you in the ute and take you to the hospital. We need to call an ambulance here. You're in crisis. And dialing back to, look, okay, you've decided this is the person that or the organisation that you want to connect in with. I've got the phone number. Sit tight. I'll sit with you. We'll put it on speaker.
Right.
And the important aspect of that, as you just touched on, Leanne, is handing over that story, because I've done it before where I've put them on speaker and they've just choked up. They don't know where to start. The emotion, and they're tired from telling you their story, and they've already gone through that exhausting process of opening up, which a lot of us don't have practice with, so it's a new thing that we're not super comfortable with. So you, as a mate, you can hand that story on to that trusted connection who's going to keep them safe or offer them whatever version of support they need. And it's about, let me hand your story over. So the demonstration was perfect. If I was handing Leanne over and I'd picked up her invitations and I'd asked her, is this what's going on for you? Yes, I'm worried about you. And if I feel I need to, I'm trained to ask about suicide and connect her on to suicidal support. But if we need to connect you up to someone who can help, who's the best person for you, Leanne? Like, you don't know. You're in a world of pain and you've got no real ideas. I've got some for you. How about this? How about we ring Lifeline? How about we ring Mates in Construction? They know how it is for tradies. They're all construction workers on the other end, and they understand the long working hours, the pressures that we have, the bullying that goes on, the drinking, the lack of talking, all of that stuff. So let's ring them, and I'll ring them now. Like, we need to do this now. I don't want to put it off till later. This is important. We're having this conversation now for a reason. If I ring them, will you talk to them? Right, let's do it. Chuck you on the speakerphone and then hand that story over. I've got Leanne with me. She said that she's not sleeping really well. She's really worried about, the uncertainty that's going on. She's got some financial pressures going on, and her partner's not being particularly supportive. I've rung you so that you can talk to Leanne. I've got her with me on speaker. And that's exactly how I would recommend we do it.
I agree. I think it's brilliant. I agree.
Absolutely love it. So we're just heading on to the knocker of an hour here, but Leanne, any final things from you there?
Yeah, I just quickly, it's really important if you are, if you're supporting a tradie, maybe, you're running the business side and they're out doing the work on job or on site. I think it's really important to have a really good, strong self-care strategy in place for you. And there's a number of quick and simple, easy things that you can do that definitely invest in yourself, because the more invested you are in your own well-being, the better you are able to have the strength to support your partner or somebody else. So a couple of very simple ideas that are easy to grab some time out and do. And in this sort of lockdown environment, I guess, is what I was thinking of. It's okay to go and have a 20-minute bath, like a soak in the bath. Yesterday, I really felt I needed some connection with people who really understood me, my besties. And so I sent them a quick message saying, what are you doing? Go and grab a coffee and we'll have a Zoom chat. And we did. We just all sat with our coffee at our computer and had a Zoom chat. And it was actually 40 minutes by the time we finished nagging, but that was great. Little things like rising earlier when the house is still asleep and just spending that time to have a quiet coffee or a sit on the couch or to watch the sunrise when everyone is still asleep before the madness of the day begins. Having a good laugh at a funny movie, watch something really funny on the telly. So those simple things I think are really important for anyone who is caring for somebody who is, you know, in a trade or in the industry, you've got to have some self-care strategies in place as well. And know that those resources are available for you too, not just for others that might seem to be more directly in the industry. If you're supporting somebody, if you're doing the business admin side of the business, the running of the business, draw on those resources yourself. Connect with people yourself.
Beautiful. Thanks so much, Leanne. It is super important, and those people, most people who are on this call are either already connected into our group program or have experienced that before, and how that supports people to just do some talking and, you know, have the coffee and have a chat. So that's really cool, and some practical stuff too. Just a question, just to make sure that we've got the question that a couple of the ladies are asking is around the staff. So we've talked obviously about the business owner here. You've both touched on the fact that there's a lot of stuff out there for staff already, but can you just touch on that a little bit for us, just to support these couple of ladies asking that info?
I can touch on some free resources that are out there for staff that you can go and download a whole range of kits and information and ideas on how to talk to people about their own wellbeing at work. And the first one that I would recommend for small business is headsup.org.au.
Put up there, or just
I would definitely be looking at those resources. They've got a tab there that says small business. So, and there's a lot of tools there that you can use if you're managing teams, and how to have conversations about wellbeing.
Right.
So I definitely look at that. I'd also be looking at the ASBFEO site, which is My Business Health. It's a relatively new site, and it's actually a portal that draws on a whole range of resources from all different points. And I would suggest looking at that as well, because there'll be some useful templates, guidelines, examples that you can use. It's free. It's all free. So
beautiful. And Erin, I'm guessing with your comment there, it's reinforcing the same message that we use with the business owners, as well as the you know, passing that down to the staff with the tell, ask, listen without judgment, connect.
Absolutely, yeah. And look, I was just thinking we do the same thing for every human, I guess. It's not different for anyone, and we do it the same way as if we're face to face, as if we're remote on the phone. You know, just follow those steps. And I also I've spent a lot of time doing first aid training, so CPR and first aid every year. I don't know if anyone else here has had that experience of doing repeatedly each year. And I think it's important to remember that no matter how many letters they tend to add each year, it always starts with D. It's DRABC. So danger to yourself. Again, I just wanted to touch on, before you spoke about keeping your cup full. So they talk about fitting your own oxygen mask first, and you can't pour from an empty cup. So those self-care things become really important, not only to keep yourself balanced and well, but I think it actually demonstrates to other people how important you think it is, and shows them simple ways to do it too. So it's got that extra added layer of, actually, this is how I think. We talked before about, I'm not trying to fix you, I'm just keeping myself well. And, you know, watch me and do as I do. It's not as hard as everyone, you know, it doesn't have to be a big deal. While you were talking, I was just looking for a link. There's a digital mental health resource list, and it's absolutely, it's gigantic. It's got every sort of digital mental health aspect for any generally, and also for any sort of vulnerability that we might have. So I will find that link and throw that up for you too. I wanted to just drill down, and I know we're running out of time, sorry. I just want to drill down on that 2 questions, because Cindy asked that question, and then it was reiterated. How do you be concerned about your staff? I think we tend to do ourselves a disservice, and it's very common that we say, I don't want to nag. So I get asked by men all the time in the industry. I've got this apprentice here, and I keep asking, he keeps saying I'm fine, and blocking me and pushing me away. What do I do? How do I not be a nagger? How do I, and this is not just a female thing, the men are asking the same question. Yeah. And my answer, from what I've seen, in the field where I'm talking to people is, and it goes back to that being a first aider, just flag with them. If I was going to first aid you, for example, I would say to you, first of all, I'm a first aider. So then every action, every word, everything I do from then on makes perfect sense in your head because I'm trained as a first aider. So I would flag with them that you're wanting to connect them, you're worried about them, and that you're probably going to be a little bit pushy and a little bit stroppy and a little bit naggy, and because I care and I'm worried about you and I'm still here. So if they're not, it's also about timing with this stuff. You can ask and ask and ask. The plumber field officer that I work with that I mentioned before, his boss took him for 17 cups of coffee.
Yeah, that's
coffee number 18, he finally said, yeah, you're right, I'm not okay, I need some help. So the thing to remember is that if you get blocked, we can be a bit stroppy and a bit naggy, but if it's helpful to sort of flag to them why, that you've done a bit of work in the space and you're offering help because you're worried, not because you're nagging. And like the other thing to remember for our own mental health is that you've put a lifeline out there for people. If you ask about this stuff in a non-judgmental way, they know that if it's not today and I'm not ready to talk to you today, they can come back to you. You are a lifeline. You will ask about things. You will have an honest and open conversation, and they can be vulnerable with you and reach out to you for help if it happens next week or down the road that they decide they need some support. Remember, you have given that lifeline, and they may not take it up immediately. So we don't have to get all panicky and worried about fixing right now. And you can say that, flag that with them. Look, it might not be today, but if you need a bit of a hand next week, you know I'm here and I'm willing to help at any time.
Yeah, it's great. I agree. I don't think you can ever offend anyone by caring for them.
Correct.
No, that's right. We never get angry as a response. Well, I mean, not never. I shouldn't say that. We do get. But again, it's about a bit of patience and going, well, okay, I get that right now is not a good time. Let's revisit it when you're ready.
I agree.
And I think that revisiting is a really important point. There is a very viral video to radio presenters, close mates. I don't know if you saw it, Woody and someone that was getting around last year. And the message I took from that video is these very close friends, one battling with depression, was that he just reinforced and always said how often he was there, and accepted what was going on for what it was, in a non-judgmental way, backed him up if perhaps the depressed friend was having not so great a day, and just sort of was there for him, and explained to people he's not his best self today, or he's not this or he's not that, and it's because of the illness that he's suffering. We didn't really get into that. We're really dealing with what's on the surface level today and how to observe and all of that, which is brilliant. But yeah, it's the reinforcing that I'm here, and the rechecking in, because if you don't get the response that you were hoping for the first time, you might get it the second or the 18th cup of coffee. And so I think we get worried, if I don't get what I want from the reaction that I was hoping for by doing all those great tell us, listen, connect steps, and I don't get the response I was hoping for, all right, well, it is what it is. No, it isn't. And so it's constantly rechecking in all the time.
Yeah, and again, the thing that stops us is that feeling of I don't want to nag. So going back to the original question, how do I support my staff? Just say to them, look, I'm not naggy, but I'm a little bit worried about you, and I'm going to keep sending you a text to check in with you to see how you are, if I can connect you up with your help. So we've got, of course, we've got Facebook, LinkedIn, all the different. So Mates in Construction's a great resource, the website for resources and data, and couple of short little videos as well that can open up a conversation if it's a lead-in to have a conversation. Darius Boyd is our ambassador in Broncos fame. So even a little short video can be a great way, an opener to have that conversation. And so jump on any of that. And again, I will make this the PDF available as well. If you guys need to get in touch with us, that help and support line, it doesn't have to be about suicide, and it's for information as well. So if you're looking to have a conversation with someone and you're not sure how to go about it, you can call us up and say, look, I need to ask this person, can I just have a practice with you? Can you remind me what I should say and how I should go about it?
That's brilliant. Well, thanks, Erin and Leanne. I think we'll close it off there. Lots of good info. I'm sure the people on the call are very grateful for your time. I know that I certainly am. This will be available, this recording, for everybody, and please share it far and wide with your networks. This is information that every business owner needs. Excuse me. Really important that we get the message out there as quickly as possible in these trying times. So share far and wide. I'll send it out to both Erin and Leanne to circulate in their networks if they find that helpful too.
And well done to Kate. Well done.
Oh, thanks.
For
Yeah.
having the conversation. Let's have more.
Kate.
Appreciate your time. Very, very grateful for it. All the ladies are saying thanks so much. Very helpful in the chat there. So have a great day. Look after yourselves, please. I know most of you fairly personally who are on the call, but those of you who are watching back, we are here for you. Leanne, Erin, our services are here for you. So in these trying times, look after yourself, look after your families, and we will be in touch. Thanks so much.